rise of the Me Too movement to what seems to be a perennial conversation about equal pay for equal work, women's issues are front and center in the national political conversation. Women are running for office in record numbers. So with that as a backdrop, Adagio Health is organizing its first ever symposium on transforming women's health, which is coming up in a little less than 2 weeks. The nonprofit organization has been providing health care across our region to women for more than 50 years at 55 sites in 23 counties. BJ Leber is president and CEO of Adagio Health, and welcome back. Good to see you. Wearing your new hat.
Thank you, Bill.
How long have you been with Adagio now?
3.5 years.
3.5 years. Okay. Well,
so the hat's not quite so new.
I know, not quite so new, but yeah, great to have you here. For folks who don't know Adagio, what's it all about?
Adagio, as you said, has been around for a very long time, and we are an organization that focuses on healthcare for women, but healthcare in the broadest sense. We're a real safety net. So we provide cancer screening, we provide reproductive health, family planning, nutrition counseling. We're a WIC provider, women, infant, and children. We have community education. We talk to kids about healthy relationships and healthy decision making. And we're really targeted towards women who don't have insurance or women who might have insurance but a mammogram that forces them to make a choice between lunches for the kids, or they might have a deductible that forces them to make a choice between lunches for the kids and a mammogram.
So can they really follow through and get the treatment they really need?
And so we help them, we get them access, and then we help them follow through and get the treatment.
And all up and down Western Pennsylvania, it sounds like, right?
23 counties in Western Pennsylvania.
State, right?
Exactly, yep. It's, we have 8 medical offices that we own and operate, and then outside of those 8, we have about 35 partners throughout Western Pennsylvania that provide services to these women. So it's a really great organization.
Well, it really. So who pays the bills to make all this possible?
Well, that's a very good question. We get federal grants, and we get state grants, and we do get contributions from generous donors, and we also generate our own income because we do accept insurance, and we do accept Medicaid. So that is something that we as a nonprofit can do to hopefully make us more sustainable, is to increase the revenue that we generate ourselves.
Well, you've got to, though, be keeping a really close eye. I started out with all this federal stuff that's going on, both at the federal and state level, in terms of what the implications of these big debates around funding for healthcare and everything else can mean to an organization like yours.
We are keeping a very close eye on that. On the state level, Governor Tom Wolf has been extremely supportive of making sure that women have access to health care, family planning, reproductive health, cancer screening. Our big cancer screening project is funded by the State Department of Health. So on the State Department, we've gotten, on the state arena, we've gotten terrific support. We're really keeping our eye on the federal government. We have already been told that there will be some reductions in funding, and quite frankly, my concern is reductions in access as much as reductions in the actual amount of funding. So potentially a reduction in the amount of funding that we have for women who require confidential services. And think about who that is. It's teenagers, it's immigrants, it's refugees, it's women in abusive situations. So we worry about the funding level, but we also worry about our ability to make sure that we can get out there and get the services to women who need them.
And so real implications in terms of how this shakes out inside the Beltway over the next several months or couple of years.
Very much so. So what we're doing is we're not waiting for them, and we're going to patients that could use our services, such as Renewal Inc., which is an organization that transitions men and women out of incarceration. We have medical offices now in their facility, and we are opening up an office in Turtle Creek in the spring in the Human Services Building, right next door to a women, infant, and children office where 1,400 Allegheny County women come per month. So we are going to go to them and make sure that we're there to provide them with service.
That is so cool. We got to tell me, we got a minute left, but we got to talk about this upcoming symposium. This is a first for Adagio.
This is a first. Yes. We're really excited. We're having a symposium March 22nd downtown, and it is about transforming women's health, and we're really focusing on policy and advocacy because we all know that's the way you really start to make sustainable change. So we have our keynote keynoter coming in who is Senator Barbara Boxer.
Oh, wow.
She was one of the original signers of the legislation that created Adagio Health, so it's a really nice circle of organizational life. We're going to focus on the opioid crisis and health disparities in marginalized communities, sexual education, and we're having continuing education credits. So we really are opening it up to the community at large and hoping that it's just the start of a more concentrated, focused advocacy effort to make sure that women have access to the health care that they deserve.
Well, you got to keep it front and center and make sure everybody's aware of what at stake, because it could affect an awful lot of people, a lot of our neighbors here in the region. If people want to get involved with the symposium or come, how do they find out about it?
AdagioHealth.org.
Easy enough.
Easy.
B.J. Leber, CEO, Adagio Health. Thank you so much.
Thanks,
Congratulations on all the good work. Yeah,
thank you very much.
When we return, building the next generation of civic leaders for our region. Stay with us.